All new at 6, the number showing millions of Americans are missing their second dose of the COVID-19 vaccine, and that could impact how quickly we put this pandemic behind us. We're going in depth on why people are hesitant to get that second dose and what local vaccination sites are doing to get people back in for round 2. Good evening and thanks for watching ABC Action News at 6. I'm Jamison Euler.
And I'm Jasmine Stiles. Wendy's on assignment. We start with our nation's fight against COVID-19. According to the CDC, millions of people are late or have missed their second dose of the COVID-19 vaccine. Now public health experts are sounding off on the importance of getting the second dose of either Pfizer or Moderna.
ABC Action News reporter Mary O'Connell is going in depth for us tonight on this issue, hearing from doctors on why some people might be skipping and what they're doing to make sure you get your second shot.
Charlotte Crane got her first dose of the Moderna vaccine about 2 weeks ago.
I got really tired, but it was nothing that I couldn't handle.
She has another 2 weeks until she's due for her second dose. But Crane admits from the get-go she was hesitant, and that hesitancy is still there for her second shot.
It sounds like this injection's going to take me down. It's very, like I said, very nerve-wracking.
Still, public health officials are pushing for folks to get fully vaccinated. We did some digging into the numbers, and according to CDC data on vaccine completion status through April 9th, among the people with sufficient time to get second doses, nearly 8% missed their second dose, or just over 5 million people. That's up compared to a recent CDC study. The CDC says if someone got 2 doses from different places, those doses may not have been linked together. But overall, it explains the increase was expected as eligibility expands.
The other big reason now is people don't want to get the second dose. It's a hassle. You have to go and make 2 appointments. And it's common knowledge, it seems to be, whether or not it's very significant, is that the second dose you feel a little bit more sick than you did after the first dose. And so there's some of that vaccine hesitancy playing into it.
The CDC says you should get your second shot as close to the recommended time frame as possible, but your second dose may be given up to 6 weeks after the first. I asked Dr. Rachel Irby, an infectious disease physician at Largo Medical Center, about herd immunity and the impact of 1 dose versus 2.
If we all get our second dose, then we all have a better chance of being immune, and you as an individual would have a better chance of fighting and being immune to the virus.
Here at the Tampa Greyhound Track vaccination site, coordinators say they have at least an 85% return rate for second doses to their site. But it's possible those remaining 15% may be getting their second dose somewhere else. And coordinators say they're also taking steps to remind people to come back.
Once they're registered into the database, they receive not only a card that has their physical date of return on it, but they're also in the database, and so the database will respond to them by whatever method they gave.
I reached out to the State Department of Health to find out how many people in Florida are overdue and what they're doing to reach out to people who might have missed their second dose. We're still waiting to hear back.
About 10% of people here in Hillsborough County who are overdue for their second shot have not come back for various reasons.
Kevin Watler with the Florida Department of Health in Hillsborough County told me they can provide the information, but he says ultimately the decision lies with each person.
You have a choice. Are you going to follow the messages? Are you going to follow the guidance? And so we want to encourage people to do your part, because if everyone wants to resume life the way they knew it before, back to normal, without having to think about putting on a mask or social distancing, if everyone wants things to resume the way it was before, it means everyone needs to get vaccinated.
For those hesitant over second dose side effects, Dr. Irby says you've already done the hard part of deciding to get a vaccine and done half the work. Ultimately, Crane told me she probably will get her second dose, looking to finish what she started.
I've come this far, may as well complete it.
In Tampa, Mary O'Connell, ABC Action News.